Hello, folks. Thanks for being here today. We appreciate you taking some time out of your day. This is the November meeting of the Carolina Community Coalition, and I am so excited for the folks we've got presenting today. I'm going to start by asking folks to introduce yourself in the chat. Tell us who you are and what organization you're with, so that everyone can say hello and so that we have attendance records. And we are somewhat fancy. So we are a kind of a standard Zoom meeting for this presentation. So you can ask questions in the chat as the presentation goes along. You can also use the Q&A if you would like to ask something anonymously. Thanks for those of you who are starting to introduce yourself. We appreciate that. And really excited. We will get started. Let me be official and read the intros of our great presenters today. My name is Amy Hargan. I should have said that. I'm the Director of Substance Use Prevention at the University of South Carolina in Columbia. So we've got two presenters today. Dr. Jim Lange is Executive Director of the Higher Ed Center for Alcohol and Drug Misuse Prevention and Recovery, an academic center of the Ohio State University. But he lives in San Diego, where he is San Diego State University's coordinator of alcohol and other drug initiatives. His expertise in campus prevention efforts is based on over 20 years at SDSU and over 25 years of prolific funded research in the field of AOD prevention. He's credited with over 70 peer-reviewed and scholarly publications and over 180 conference and invited guest presentations. Dr. Lange has also spearheaded statewide and local coalitions and other major prevention initiatives. And then Allison Smith, M.P.A, is the Director of Health Strategy and Outcomes at New York University. And I'm so excited because I want somebody with that title here at USC, because that sounds like a really cool job. Additionally, she co-leads the Action Network for Equitable Wellbeing. Allison has an extensive background in designing and leading networks, igniting innovation, building capacity and capability for continuous improvement, facilitating equity-centered, co-designed approaches, and guiding diverse teams toward outcomes-driven systemic change. Allison has led several groundbreaking national improvement collaboratives, which have engaged over 100 institutions of higher education and achieved measurable improvements across various indicators. She also developed the Wellbeing Improvement Survey for higher education settings, WISHES, which is what we're talking about today. Additionally, Allison has a track record of guiding institutional level systemic change at NYU, earning national recognition for innovation and excellence. Her recent accomplishments include facilitating university-wide efforts to address equity gaps among NYU students and developing opportunities to co-design and co-lead change efforts with students. So thanks to both of you for being here and for sharing with us today about the WISHES project, and I will turn it over to you.
Well, thank you. And when you asked me to present on WISHES, I went back to a time a few months ago when I was asked to talk about WISHES, and it happened to be that Allison was going to be in California, where the conference was, and roped her in to that presentation. And this time I was a little more proactive and and roped her in because really it's valuable for you to hear not just about the survey, but around all of the elements around it, why there's a WISHES survey, what you could potentially do with it. And so Allison being here is going to help answer some questions, I'm sure, and that you have in a way that's far more accurate than if I had done it. So that said, I'm gonna go ahead and share my screen and do all that bit. I got too many windows open. Should have closed them before this. Let's see here. And all right, hopefully you are seeing Hopefully you're now
There
seeing
it goes.
the slides. Um, and there's a lot of folks who helped with this. As I said, we've done presentations in various forms. I have some colleagues here at SDSU who have helped also with some of the work that I'm going to show that we've done around this with this survey. All right, well, just to kind of step back to maybe something more familiar, you probably have seen SAMHSA's and now DEA also adopting the same concept of strategic processes. And if it's a little new or it's been a while, you could think of this as a cycle where you do some assessment, you understand what the capacities you have, you make some plans, you implement your programs, you evaluate it, and then you keep going. And in theory, you're making improvements along the way. So assessment is kind of built into hopefully a lot of what you're doing, or maybe you aren't, but you know that it's ideal that you would do it. So you need to find ways of assessing what's going on. And so what we'll do is I'll show you some of the ways that this can work out, but also some of the ways that it hasn't worked out. So for instance, I have a project trying to get campuses to work together to address impaired driving and amongst college students. And within that process, I will ask them about the impaired driving issue on their campus. And what I've recently been coming up against is a lot of times they just say, oh, that's not one of our problems, or we have reasons that we're not going to focus on it. But in fact, when I dig deeper, that it's not one of our problems isn't necessarily the case. It's just they don't see it. They haven't found data around it, or they haven't used the data that they may have, and they make a lot of assumptions of what's going on. Like the younger students are living in dorms. They don't have cars, or they don't use their cars, or they tend to stay close to campus. That may be true, but they don't have data around it. And then when I ask, well, do you do something like the NCHA, the National Collegiate Health Assessment? It has items around impaired driving, but I've found that people don't necessarily look at those. Because there's 800 variables in the NCHA. And so there's only so many analyses you can really dive into. And so that has helped them stay misinformed about what's going on, or at least not informed at all. And then there's other sort of things like, oh, well, Uber and Lyft have solved this problem, so I don't need to measure. I don't need to ask the questions. So a lot of assumptions that aren't being tested. And as we start probing, we're finding that they are finding surprises within the data, within just talking to students about it. And so what we want to do is kind of go back to that model. Or are you doing the assessment before you're deciding what not to do as much as what to do? And in that context, we can start talking about, well, why would you collect any data? And this is where it's important to start with the motivations for different types of data collection. So a lot of times when people say, sometimes I'll talk to people and they say, I love data. The data is really great. I love to have that with me. And then the question is, well, how are you using it? A lot of times the data is used for two reasons on campuses. A lot of times it's for research. Perhaps you're curious about something, maybe some relationships, or you have some hypotheses, and you can use the research to test those hypotheses, or to learn more about mechanisms. That's great. That will help develop new knowledge, but it isn't necessarily the type of approach that will guide your programs. Another very common motivation for assessment or measurement is accountability, or another term could be benchmarking or comparative. That is important. A lot of times, if you're in a state university, you have to meet benchmarks, or you need to understand where you fit within a group of campuses on certain issues. That sort of accountability or benchmarking is probably the most important motivation for something like the NCHA, the big surveys that people do here at San Diego State University. We do the National Collegiate Health Assessment every 3 years. Now, that's great if we want to compare ourselves to the other CSU campuses or the national data. We can see if we're better or worse. It doesn't necessarily mean, even if you're better, it doesn't mean that there aren't students who are falling into a situation that's being measured that isn't helpful. But you can see where you stand. But for instance, with a 3-year cadence on a survey, imagine you did your measure once, and then you wait 3 years to do it again. A lot of those students are going to be different now. And you don't actually even have the ability to show a trend with just 2 points. So you really would need to go another 3 years to maybe find a trend if you were interested in trends. And so it's not useful for program evaluation or for really much of the development aspects at all. So it doesn't fit with the sort of work, the daily work of a health promotion department or others on campus who are concerned about what's going on their campus. So then the third is the improvement approach, and that aim is different. It's not research, but it can feed into research. It's not accountability, but it also can feed into that benchmarking or comparative component. But it is intended to work with an improvement approach where you are looking and learning about what's going on with the students, and then using that to develop in that sort of cycle that's implied in the strategic planning approach. And so understanding these reasons will also help you understand why some tools are better for certain things. So for research, it's often, it could be very niche type of questions, because you have a specific question you're trying to find the answer to within your research. With accountability, it can be broad. It can be that NCHA 800 variable type of thing. So you have lots of benchmarks, but the improvement approach is going to need to be constructed in a different way. And with that, I'll ask Allison to maybe talk a couple on the next slides.
Sure. Hi, everyone. It's really nice to be here with you. Just on the side before, one other point that I would add is that often I see campuses that say that their stated purpose for collecting data is improvement, but there's a mismatch between the stated purpose and the kinds of methods that are being used. which really is a major hindrance to being able to use effective data inspired or driven change-making methods. And so that's one of the problems that we were trying to solve with the development of wishes. Jim started to get into the importance of having multiple data points, of looking at NCHA, two administrations over 6 years. The technical definition for a trend is that 6-point data points going in the same direction. So if we were to extrapolate that out, it would take us and that's assuming we actually have improvement, 18 years to even know if we had any kind of improvement, and the likelihood is we probably don't actually have 18 years of consecutive improvement. So next slide, please. And so what in the work that I've done through these national improvement collaboratives is try to build capability and capacity as well as tools around data informed change making. And a number of years ago, one of our collaboratives was focused on really big focus of transformational change in support of population health, better experience of care, and lower cost. And it was really about what does it mean to shift paradigms? And one of the biggest barriers that we came up against was that while schools have an abundance of data, it's not for lack of data, it's that schools either didn't have the right data, didn't have the ability to get the data, that it was infrequently reported on, or it had no connection whatsoever to what actually really mattered to institutions. Our hope, or what we initially set out to do, was use already existing data, again, from the place of there's so much data, students are over surveyed. So let's see how we might be able to solve this with existing data. And it was not solvable. And so that's really the origin story of Wishes, the Wellbeing Improvement Survey for higher education settings. We never set out to create a survey, but ultimately it was born out of this problem that we didn't have the right data to be able to do true large-scale systemic change work. And so the design of what we were trying to create was timely. So not waiting 6 months to find out what your survey results said. Actionable, that every data point was something that if we were collecting it, it had to be important enough for people to want to act on it, and that the data could be used for the purpose of improvement, really from the lens of norm structures and processes to help enable more students to thrive and flourish. Next slide, please. So just very briefly, the network that Jim and I are part of and have co-led together is called the Action Network for Equitable Wellbeing. And at the center is the outcome of systemic change for equitable well-being. And we think about it from 3 lenses. One is the actual data, being Wishes, as our shared tool for measurement, or everyone in the network uses the same survey. You can use it however you want, but schools that are doing intensive change-making work together as part of a community administer it frequently, about twice a semester or more frequently. We focus on the capability and capacity for effective change-making methods. It's not enough to just have data, but there's a lot of gaps in institutions' knowledge and skill to be able to translate that data into action and ultimately into improvement. And then a focus on community, where the work is really hard, that. And so we believe that we can go further faster when working together. Next slide, please. The Wishes is short. It is 48 questions. It is not intended to be all things for all people and every last possible question you might have about your students. It is intended to be sort of almost like a pulse survey on the outcomes and experiences that matter most. Not again an exploratory of like, this is the comprehensive inventory of all things health, mental health, behavioral health. We have some demographics on the survey because health is not created equal for all of our students. So this allows us to be able to disaggregate and understand the distribution of health and really lean into who are the students who are, or populations of students that are disproportionately struggling. And the last point that I will make on the slide, in the biggest letters at the very bottom, that Wishes is free. It's a little bit different in administration where we give you the questions and you administer it on your own platform, which allows you to embed identifying information if that is something that you want, without ever having to turn those sensitive pieces of information over to a third party. It also allows you to have instantaneous access to your own data. So if you're like me, when a survey is going on and you're really obsessive about wanting to know how it's going, like you can stay up all night going refresh, 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 and see those results because they live on your own platform. And then once the survey closes, then you submit the de-identified data to us centrally. So it works a little different. It's free, and it's intentionally connected to a broader theory of change about what matters most, from the conditions that create well-being to those outcomes that really tell us about how students are doing in their lives. Next slide, please. And this is just one slide of like how we've used our data and the kind of story that has been very compelling for a lot of different campuses, where those experiences on the left that I showed on the slide previous, how they connect to outcomes and students' lives. So for example, a faculty member cares about me as a person. A student that says yes, definitely is less likely to experience psychological distress than a student who says, no, I don't feel like I have a faculty member who cares about me as a person. Not, these are correlation, not even correlations, they are frequencies. So it does not equal causation, but it again ties back to a theory of change, and is really compelling where there is some relationship, although we can't get into what is causative there. And so there's lots of different kinds of visualizations that you can do with the data, but it's really simple, and speaks to lots of different kinds of partners or people who should be partnering with you, and helps them see themselves in your data and having a role in supporting student health and mental health and behavioral health. Next slide, please.
I think this is where I'll take it back
Excellent.
for a bit. And talk about how we started using Wishes at San Diego State University. At first, it was with minimal administrative knowledge, but some where we used a group of students that we knew were in distress, and demonstrated the ability to do the Wishes survey with them and learn more about. We've also done it in an intercept approach, and now, of course, we've institutionalized it, and it's a random sample approach. So I'll talk a little bit about the first with our economic crisis response team. That was our first foray into it. We were looking at students who were either coming in for food or other types of distress, versus housing distress, and trying to better understand what may be going on. And so we sent it out based on their participation or checking into our center. And not too surprisingly, the survey was able to capture that those who were in housing distress and need were in more distress than our general group of economic distress. But one of the things that I found useful was to kind of dive a little deeper and see if we could understand better if wishes was predicting a different types of things. And one of the things that is within the survey is asking about negative interactions. And if a student has had some of those, they're able to check boxes of what may have been the topic or the reason for those interactions. And we found that, not too surprisingly, that economic issues were more likely with our housing needing students. And but what we also found was that in fact, some of the distress that we were seeing was actually mediated by that negative interaction. And so that starts speaking to the concept of stigma. And so, you know, it isn't just not having housing at that time, it's also the stigma around it and the interactions. And so you can learn a little bit more about what may be going on if you have a population that you have concerns for. And then, of course, we would want to go a lot farther with that sort of finding to better understand what was going on. But it did help us demonstrate the value of measuring these measures, this group of measures for our students that are some of our ones that we're most concerned about. And I think I just talked about that. And so we did that as a monthly survey. We're sending it out. It's an email. So it's on Qualtrics. So it's pretty easy. We did have some incentives and we had findings, which was a pretty cool start to have a new survey on your campus. And it was pretty easy. We had a pretty good response rate amongst that indicated population. Then I had some students who had they were in a research honors program, and they needed a study, and so I helped them develop some hypotheses. They were both RAs, and they had the hypothesis that the students who live in dorms close to our student center, which is kind of the center of our campus, would feel more belonging than those who are kind of far, kind of a long walk from the center of campus. And so it was a great hypothesis for a project that would be an intercept survey because they really only needed a table, a QR code, and some candy bars, and they could go in front of the residence halls that were close to our student union or far. And they were able to find a pretty nice linear relationship between sense of belonging and distance from their dorm. We, of course, sent that over to our housing department so that they could start thinking about ways to make sure our students who are farther away from our student union can start maybe hopefully feeling a little bit more belonging. And so it just did two things. One, it again kind of demonstrated that you can have a hypothesis. This is and you could test it with this, but also how easy it is because it's short. It doesn't take students long to do it. And that means that even just outdoors at a table, they'll do it for a candy bar and everyone's happy with that interaction. So with those two sort of pilots or demonstrations, it was easy for me to go to our dean of students and start talking to him about the Wishes survey and what it's doing, and also that there's other campuses doing it who have some amazing findings. And I'll show you, we kind of copied one of the campuses that helped persuade our dean of students to do this about a dashboard. But that said, he was all in, and we have started, we now are in our third year, I think, of administering it at SDSU. We're at a monthly cadence. So on every full month of the academic year, so that's 6 months, a tranche of students who have will be given the invitation. All students over the course of the year will get an invitation, but they'll only get it in one of those 6 months. That gives us a lot of data. SDSU this year we're at just under 40,000 students, and so we have a lot of students, even with the typically not great response rates, although Wishes was giving us better than NCHA. So, and every month we're getting these, and so as our data set is getting mature, we'll know more about things like, well, what does a November look like, and what does an April look like? And but of course we need more Aprils and more Novembers. So that's going to take a little time to build, but there's a lot we can do in the meantime. It is the entire student population. That's also our graduate students. And we developed, the office that's actually running it, a public-facing dashboard with our data. So since it's public-facing, I'm showing you. I think this is a touch old. I didn't update it for this particular. Actually, I did. I ran this 2 weeks ago for a different presentation, and I picked a couple. The Wishes survey. I'm the Alcohol and Other Drug Initiative coordinator, and so I was very interested, and I'm still interested in what's going on with alcohol in this. And so this was some of the numbers that we're seeing. Not surprisingly, norms correction is always handy. We're a party school, but only 29% of our students have recently had 4 or 5 drinks. So that is useful to have for certain things. But again, these are the types of things some colleges are doing with the Wishes to make it easier to share across the campus, to allow for building partnerships to actually make some changes. We have an office that it's run out of. It's an assessment office, and that dashboard was very exciting for them because they have a mantra of trying to democratizing the data and letting people see it. The NCHA on our campus, at least, is notorious. It sits on my desk. It sits on a couple other desks. I look at a couple of the variables that I'm interested in. I tell everyone that it exists, and they say, so what does it say? And I said, data don't say anything. You have to analyze it. You need to tell me what to do, and I'll do the analysis. But then they never come back to me. So this dashboard idea, so people can play with it and see what is going on, I think is really helpful. It keeps it live, and it literally is live. After every month, they update the data set within it. We also do not do it as an anonymous survey. We do it as a confidential survey. because it's run out of our assessment office, they're capable of subject protection, student records protection. So you can't find a person within it without them, and they won't do it. And so that helps a lot because it also means we can merge other data sets, like, are they in a fraternity or sorority? Are they an athlete? Which college are they in? Other recognized student organizations, are they a resident or not, or commuter? We also, not too surprising because this happened with the NCHA as well. This particular, the Wishes survey is a much richer survey for gender identity. NCHA is pretty good too, but our records at SDSU are horrible. And so we end up having just like out of the 40,000 students, 80 non-binary students. Well, that's not true. When you give them a bigger list, you're going to find a lot more people who are identifying something different. And so, that's helpful to see those differences in data sets, but where their data sets are our only approach, we use those and merge them as we need. And then the other thing that is really valuable that Allison touched on is the customization. You don't change any of the Wishes course questions, but you can add questions because it's a Qualtrics survey, so you could put it on. Now, we really try to hold to the idea that it has to be short so that we don't ruin that piece of Wishes that everyone loves, which is it's pretty short. So every month, we have what we call a writer, where we'll put something that we think is important for us to either evaluate or do some digging on. And so we have put in on an annual basis a question about opioid overdose and Narcan use. And this is really helpful for us because we have a lot of initiatives around Narcan distribution, test strips, education around it. And now our state is actually requiring us to do some of this. And so the ability for us to see improvements based on the work that we've been doing is very heartening, but also tells us we're on the right track. We can do some improvements still. But these are two different administrations, the spring 2023 and the fall. So the fall is after, like a before-after type of deal. We do a lot in orientation, and not too surprising, we see dramatic improvements on things like we make it simple for you to react to a suspected overdose. That's important to us. And to see that they think they're more likely to say it's simple after what we've been doing is very helpful. These are just some more approaches, like just some, not just kind of, some of this is actually a scale we put in. But it just shows the ability for a writer to be useful. We can do some correlations along with the other items in this as well, but this particular topic is not necessarily something we'll do a lot of cross analyses. And then finally, just so you can get very excited about data, and I like this quote, and I've mentioned it a couple times, and Allison will be a champion of us always remembering that the data doesn't tell it all. You do need the data, but you need the stories as well. And so there are approaches, there are resources, including with the Action Network, but they're based on on some of the improvement science components that would help you know what to do next with the data. And I'm going to, are you going to take this, Allison?
Sure.
Okay.
Either way, but sure. I would just say on this, through a news guided change making pathways, wishes is just one component. And we have mapped out a series of deliverables or milestones in that improvement journey. So ability to administer wishes, investment in using wishes is one of those milestones. And another is getting to the point where you have identified a population of students who is disproportionately struggling, which then allows us to take a systematic approach to understanding the underlying systems that shape those outcomes. And that process involves looking not just at wishes data, because again, it's 48 questions, 48 powerful questions, in my opinion. And there's a lot of other data at your institution that matter. So how can we triangulate a story that leverages all existing data sources to understand the underlying system, and those stories of the best way to understand a student's experience is to actually ask them. And for the people who are in positions of providing support to students, whether that be faculty or other kinds of support teams, not about what they think about what students experience, but about their own experiences of trying to support their students. And that sort of holistic view of the system allows us to better understand where there's those points of high impact intervention or shifts in our system are needed. And I'll just also say that I love, Jim, that you added this particular resource. I actually didn't know that they had it publicly available. And we, as a new facilitation team, have taken a lot of what we've learned from using this kind of process and adapting it to a higher ed setting with language that's more specific to students' experiences and the kinds of roles that are on a college campus. So for institutions that are interested in joining these intensive cohort experiences, get access to resources that are adapted and still grounded in structured methods for change using improvement science. But for me, the stories of the students tell us the why the inequities or disparities exist, whereas the quantitative data often gives us a good picture as to what disparities exist, and we can't get to the why without actually talking to human beings. And it's, for me, some of like the most meaningful part of the work that I do. Wishes is free. It's work, but it's free. And again, it doesn't sit in isolation of just being a tool for the sake of collecting data. Institutions can use it however they want. You create your own administration strategy. You decide how frequently you want to administer it. But we do have some strongly worded recommendations of what we think maximizes the impact of the use of the instrument. And here are just some of the benefits that we've talked about throughout the presentation and that Jim helped bring to life. Our dashboard and what you would get for free is not nearly as beautiful as what Jim showed. So I do just need to be transparent about that. It's pretty bare bones. But the ultimate goal of being in a community of change makers is that we learn together. And my hope or vision for the work is that in 10 years, we will actually see measurable improvement on wishes around closing the disparity or the gap around communities of students that are disproportionately struggling today.
Yeah, and I'll just throw in that dashboard component. It really is valuable if you have the folks on campus, and there probably are some who could do that. Like, for instance, the ability to merge those records. Like, if you can click on freshmen, you can click on other variables that we port in. Not all of our records, in, especially anything we think will start getting down into very few people, so they're identifiable, and also that can't be too cluttered. But it does pique people's interest if you are able to create those. I personally can't, but I know people who can, so that's what's important.
I'll also share that we've had a wide range of institution types who are using wishes, from institutions that have dedicated assessment folks who know how to make fancy dashboards to institutions that don't have Qualtrics and don't have dedicated people who know how to really do anything with data, to who are learning and starting at a beginner's level and have been able to do this. So you don't necessarily have to jump in with like all the bells and whistles of what Jim shared, and that it is possible to be a community college with extremely limited resources and do this.
Well, and that's why I showed some of the work we did early on, a table QR code and a
Yeah.
and candy bars got us to understand something pretty profound about our campus, that distance matters. And so, yeah, it can, and I do think starting at that level is a nice approach if you're nervous about going all in. And I think we're at the a QR code to get more information.
I would just add that one of the additional benefits of doing repeat administration, where you're not putting like all your eggs in every 3-year model, is that it also gives you the flexibility to experiment with different kinds of administration, whether that be incentives, the subject line, who it comes from, the language in the invitation. So you can iterate and learn about how to maximize response rates because you're doing it over and over. And then last thing in this, please, if you're interested, fill out this form and it'll give you access to our terms of use. You cannot get the questions until this terms of use is signed, but the terms of use does not require you to actually use wishes, but should you, you are required to follow the terms of use. Thank you.
Yeah, and then the other wait, what was it? When you were talking about, it'll come to me later. Maybe someone will ask a question. I will just do one more in case you haven't interacted with the Higher Ed Center for Alcohol and Drug Misuse Prevention and Recovery out of Ohio State. We call it the HECAOD. We have lots of webinars. There was one on with athletes just today, and many of them are free. And there's also archives of webinars in various forms. So I encourage you to check us out. We also have a conference this year. It's going to be in October as opposed to a summertime. You heard it, you didn't hear it here first because we haven't announced it, but we're about to. But you can start looking at your calendars for what you're doing in the fall for an in-person conference. You can also usually find us at NASPA Strategies, NASPA, Big NASPA, and ACHA and other places. we love to connect in person if possible.
And I'll
Thank you
just
so much.
just one other, if you are somebody that needs to get sign off from somebody else, almost no decision maker will sign off on like, let's do wishes forever and every month. And I think Jim's approach of like, start where you can get the yes, like if that means you're doing it once with a small group of students, just take the yes and you can build from there. But we have rarely seen a decision maker sign off on the long-term vision without ever actually experiencing the benefits. So we've learned that the best way to use wishes is to just start wherever you can get the yes.
And point that other campus, some people are really persuaded by the fact that some big campuses out there are using it.
Yeah, I think this needs to be a conversation within our SEC group. Because that, we don't do anything in the SEC if we don't know what everybody else in the SEC is doing. So thank you both so much for the information. And I think it's interesting, but I hope that some of the folks in the call got to hear some great examples that apply to other areas of campus as well. We've got two folks on the call who are kind of part of our panel for some more conversation. And so I will let Emily and Tiffany introduce themselves and kind of lead us off with questions. If you have questions, audience, feel free to put them in the chat, use the QA function, or raise your hand and I'll call on you. Emily, you came off mute first, so tell us about yourself.
Good afternoon, everyone. My name is Emily Cato. I use she, her pronouns, and I am the Director of Healthy Campus Initiatives at the University of South Carolina. So I get to work really closely with Amy on a lot of different things. I am the NACHA person at USC. And so I utilize that data. Jim, when you said that like NACHA sits on your desk and lives there, it spoke to my soul. So I appreciate that that is happening for other people as well. So I'll turn it over to Tiffany before I start with my questions.
I can introduce myself. Hello, everyone. Tiffany Howard. I am the Director of Outreach and Engagement within Counseling and Psychiatry. So it's nice to be here. I also use she, her pronouns. And so I will hand it back to Emily for her first question.
I guess so. The biggest thing, we are obviously, well, not obviously, we are planning right now for a deployment for NACHA in the spring. And so one of the things that we have decided to do this time that we've not done in the past is really go into those academic spaces and figure out like what can we help the deans learn about their prospective students and respective students, excuse me. And so one of the questions that I keep getting asked is about survey fatigue. And so I'm curious, Allison or Jim, from your perspective, what does that look like, especially if you guys are kind of doing this regularly? You're obviously bumping up against other surveys that are going out across your campus. So we just wanted to ask that question.
Yeah, I can tell you what we do at SDSU. So last year, as I mentioned, this last semester was our NCHA year. We held back 10,000 students from the selection for wishes. So we still had a good close to 30,000 students in those 6 months, but then the 10,000 that we held back got the invitation to do the NCHA. So no one took both the NCHA and the wishes. It happened, there was people taking both surveys in April. But so that's how we handled that.
We've also done the same at NYU, and many schools have used the same method of just being strategic, especially at big schools, being strategic about the distribution of samples. I will say it's really fun to do simultaneous administrations. where everything is exactly the same, with like same language for the invitation, who it's coming from, same prizes, and the only thing that's different is the link. And being able to compare, there are some very intentionally some measures that are the same on NCHA, Wishes, and Healthy Mind, so that because we know those are still needed, this isn't a replacement for those, it is a different purpose. And it allows schools to triangulate, and it's really, really fun to do some comparisons. Like we've had much, much higher response rates with Wishes, which shouldn't be a surprise because it's shorter. But also some of our measures were worse in Wishes, where, and that pattern has been replicated by several other schools. And our theory is that because it's shorter, students who are sicker are better able to actually finish the survey. So we're picking up on maybe what might be a truer prevalence of different experiences than a very long survey. We don't know that obviously to be true, but it is a phenomenon that has been replicated.
Yeah, and that a partial completion of NCHA is not reported back to you. You only get completion. So they have to be able to go through the 45 minutes to an hour of the NCHA to finish for you to see any of their data.
All that to say, to go back to your first question, which is actually a very big question that people, or reason that people feel hesitant to move forward with Wishes, is the survey fatigue. And we've just not seen that. Again, with it's in some sense can be mitigated by being strategic with how many students you are allowed to survey and how you want to distribute them. And then the other is that students actually find value in completing the survey because it's things that it matters to them, these experiences. We've heard of a number of campuses who have gotten like, thanks for asking me these questions. And schools are actually able to use their data and feed that back to students. And so they feel like when they're being asked questions, it's actually mattering to their campuses. So like response rates are down overall, and we've seen that too, but not like, it doesn't solve for the problem, but it's not a disproportionate or contributor to the problem.
Cool.
We are almost out of time, and some of us could chat about this for a long time, and we could still do that. I put a plug in the chat, but Jenna, I wanted to give you 30 seconds to plug our next Carolina Coalition meeting on December 5th. So I'm gonna let Jenna jump in here.
Thank you, Amy. Thanks for putting that in the chat. We're going to be doing something a little bit differently for our next coalition meeting. We're going to do a brainstorming / action planning session. It'll be December 5th at 4 p.m. And we're going to try to do that in person at Russell House 304, just so that we can have more opportunities for engagement and hearing what you all think are important issues that we should be addressing, and then coming up with what we want to do as a coalition to address those with USC and the surrounding community. So we'd appreciate it for anyone who's able to be there.
Thank you, Jenna. Any last words or questions? I can see Emily has 5 more questions she wants to ask.
No, but I got fair pickup.
Well, I'll just say this is one of my favorite things to talk about, and if anybody would like to nerd out more, and I think Jim, I don't want to speak for you, but has often offered, it is meaningful for campuses who want to get involved, and we love to chat about Wishes. So
I love it. Thank you both so much. And I just think the approach is so revolutionary, right? It's just thinking about our data in a different way, whether it's Wishes or NCHA. I think some of this can be applied to just how we're thinking about the data that we have. Although obviously I'm sold on all the full thing. So Great. Thank you both so much for being here. Thanks to our folks who are participating today. And we will see you on December 5th in Russell House. Thanks. Bye.